Everyone, my name is Jinan Fiati. I'm from Lakehead University Computer Science Department at Canada, Thunder Bay, and I would like to thank the organization committee of the Meta 2023 International Conference for inviting me to present this speech. And my presentation or my paper is entitled Thick Data Techniques for Identifying Abnormality in capsule endoscopy videos. And this research is actually in collaboration with Dr. Petros. He's a medical doctor from Thunder Bay Regional Health Science Center, and as well as the collaboration with Dr. Mohammed. Also, I am chair of SIG on Big Data for eHealth with IEEE ComSIG. My main area of research is in collaborative learning, big data, AI, and health informatics. This is what you see, my email. Then definitely you can collaborate with me through the emails. This research is mainly about a disease or inflammatory bowel disease, which includes both Crohn's disease and ulcerative colitis. This disease affects a large number of people in millions, like in America and Canada, and it's a lifelong condition which can be treated but is actually not cured. So the inflammatory bowel disease can significantly affect a patient's quality of life and may have a high financial burden. So you can see, for example, in Canada, the blue numbers, it's number of people who they are infected with the inflammatory bowel disease. And this definitely will have a big burden on the hospitals. Like you can see, the number of hospitals is not increasing through the number of years, and it has a big burden on the physicians. Again, because the red one, the gray one, the number of physicians is not increasing significantly, while the people who they are infected with the inflammatory bowel disease, it's increasing from 1 year to the other. So the inflammatory bowel disease is actually mainly those two types of diseases, which is the ulcerative colitis and the Crohn's disease. The symptoms of those two diseases, they are different according to some factors. Like, for example, if you look at the location of the pain, in the ulcerative colitis, it's in the inner lining of the abdomen only, while in the Crohn's disease, it's actually looks like several layers. If you go to the pattern, the ulcerative colitis, it's in the lower left abdomen, while in the Crohn's disease in the lower right abdomen. So there are significant difference between the symptoms of those two diseases. This is the pattern of the Crohn's disease, and this is the pattern of the ulcerative colitis. In this pattern, definitely you can see that the ulcerative colitis is limited to the colon. So you can see it's only in the colon part, while in the Crohn's disease it can occur anywhere, like between the mouth and the anus. So in Crohn's disease, actually, there are healthy parts of the intestine which is mixed in between inflamed areas, while the ulcerative colitis, it's a continuous, you can see it's a continuous inflammation of the colon. So people can get confused when it comes to differentiating between inflammatory bowel disease, the Crohn's disease, and the ulcerative colitis. So the short explanation is that the inflammatory bowel disease is the umbrella term for the conditions under which both Crohn's disease and ulcerative colitis fall in. So you can see the issue that we cannot ignore Crohn's disease identification accurately because of the complication and health risk of this condition, which can be devastating. Crohn's disease Actually, those Crohn's diseases is a type of inflammatory bowel disease. It causes swelling of the tissues, inflammation in your digestive tract, which can lead to abdominal pain, severe diarrhea, those are the symptoms, fatigue, weight loss, and malnutrition. Also, definitely those Crohn's diseases can be involved and in the large intestine, which increase the risk of colon cancer. So you can see those ulcers, which they are open sore called ulcers, can form in your, like from the mouth, stomach to the rectum. So they are distributed. They are not continuous like the ulcerative colitis. The Crohn's disease is different. This is the different between, like, the way of examining the ulcerative colitis, and this is the way of examining the Crohn's disease. In the ulcerative colitis, definitely there is a different procedure than the Crohn's disease. In the Crohn's disease, what is happening, like the way the data is collected, because we are analyzing those video images. So the it's using colonoscopy. So colonoscopy, what is it? It's a procedure in which a doctor uses a long, flexible, narrow tube with a tiny camera on one end, which is called colonoscope or endoscope, to look inside your rectum and colon. This is for the, this can so if you ask, for example, a question, can Crohn's be missed on colonoscopy? The answer is you may also have Crohn's disease in another part because of your digestive tract that cannot be seen during a colonoscopy. That's why we need a capsule endoscopy, which is a procedure that involves swallowing a small capsule, which is in the size of a large vitamin pill. Inside this capsule, there is a tiny wireless camera that takes pictures as it passes through the small intestine. And those images, they are transmitted to a recording device which is worn on a belt around the waist of the patient. This is how it is done. So, but before doing this procedure, definitely the physician, they go into some kind of lab test to see whether the Crohn's disease is positive or not. So if it is a positive, go to A, and then it goes again through several procedures until it will be decided to go in capsule endoscopy, which is this one I just explained, which is a camera that goes through the small intestine mainly to take the picture or the images or take the video of the colon area and the rest and other areas. So in here you can see this is so detection, localization, and segmentation of anomalies for capsule endoscopy may involve variety of anomalies types. These anomalies may include, among others, definitely ulcers or erosions, which are the characteristic features of the Crohn's disease. So you can see in this figure illustrates some of the common anomalies found in any capsule endoscopy video. This research actually has been ignited by a lot of physicians' requests, like Dr. Zizos, in order to reduce their workload as they are burned viewing multi-thousands of video frames after each video capsule endoscopy intervention. In order to identify a colon problem like the Crohn's disease, which requires a lot of focus to find the inflammation area. So what is the main cause of Crohn's disease? Actually, experts, they think it's a bacteria in your digestive tract which can mistakenly trigger your immune system. This immune system response causes inflammation, leading to symptoms of Crohn's disease. This figure illustrates samples of Crohn's disease patterns as provided by the Atlas of Endoscopic Image in Inflammatory Bowel Disease. As Crohn's disease may affect different parts of the digestive system, as well as because of its patchy nature, where the affected areas may be small or multiple and of variable size and extent, it is difficult for the endoscopist to determine with accuracy the extent and the severity of the disease. So that's why actually the colonoscopy in all forms, whether it is optical colonoscopy, virtual colonoscopy, colon capsule endoscopy, they are considered as the golden standard for detecting various colon anomalies, including polyps, ulcerative colitis, even cancer. So it has been also recommended as a regular screening test for a group of patients who encounter no symptoms related to their colon for early detection and prevention of cancer, as many anomalies like polyps are likely to develop later to a cancer. So however, different type of endoscopy is providing very large number of frames, like 10,000 in the frames in the case of the ulcerative colitis and 50,000 in the case of the Crohn's disease. In this case, it will be very difficult for the specialist to detect different types of ulcerative colitis. So research shows that ulcerative colitis severity scoring accuracy may depend on the experience of the examining physician, like whether he has experience or not. Then definitely this will affect the accuracy or the how severe the ulcerative colitis. Also, it depends on the type of the colonoscopy device they use. There are some of the devices that is high definition or normal definition video. So however, evidence shows very marginal improvement can be gained with the use of high definition colonoscopy device. As you can see, that physician will need a very long time trying to label those frames, like annotating each anomaly. In order to minimize the effect of the physician experience, most of the research body currently is pointing to the importance of using more computer-aided software, including artificial intelligence, for validating the endoscopic assessment of UC, ulcerative colitis, as well as for predicting patterns that may be missed by the evaluator. So in this direction, deep learning convolutional neural network has made significant success in the area of medical image analysis, and in particular in the area of colonoscopy, mainly identifying polyps with high accuracy, but not ulcerative colitis. However, the deep learning convolutional neural network, largely it's a black box predictors with no power to provide explanation, like why this severity, why this kind of ulcerative. So there is no power of providing explanation for the reason or underlying reasons of classifying, which is very important for evidence-based care practice. Moreover, neural networks in general are sensitive to the availability of large representative training sample. But actually, we don't have in our study large sample of data. This is why machine learning, including deep learning, cannot effectively result in reliable and robust accuracy in classifying medical images unless the neural net is trained on extremely large annotated sample, which is big data. Again, as I mentioned, but with many medical practice like the inflammatory bowel disease, the annotated training data is relatively small, requiring more additive techniques to predict important indicators like identifier acute ulcerative colitis region of interest. So in this direction, what we need is what we need in the medical world is not only quantitative approach based on machine learning and big data. We will need other techniques like physician heuristic, qualitative physician heuristic, qualitative techniques, and we need is to use explainable artificial intelligence approach to provide clue to the reasoning of the deep learning convolutional network and why specific frame has been segmented with particular score of ulcerative colitis. So all those bubbles you can see in here, those are techniques and methods which is collectively called thick data. That's why we need thick data to support clinical context and deal with the small samples. Those are the conference which I present previously my paper on ulcerative colitis, and then I move to the Crohn's diseases. So identifying the patchy pattern in the Crohn's disease in video colonoscopy sequence is a difficult task for any expert, even with perfect viewing condition and high expertise. This work presents a new framework to detect Crohn's disease lesions from videos of the small bowel using a hybrid computer vision and deep learning technique. Although both of the optical colonoscopy and the capsule endoscopy device allow visualization on the colon muscles, the capsule endoscopy is used primarily for examining of the small bowel. So our proposed framework, first stage is lesion sensing. Start with identifying out of distribution frames representing the anomalies in the video small bowel frames. It's a critical stage before using any deep learning techniques. So acute detection of ulcerative colitis, polyps, and colon cancer is the most critical issue during a colonoscopy. Therefore, it is important to increase the detection rate of lesions associated with diseases of the colon via endoscopy. In this research, the first stage is localizing of abnormal colon patterns through the use of thick data image augmentation technique, followed by the identification of Crohn's disease pattern through the use of Siamese neural network. And third is the categorization of 3 groups of video frame with colon with Crohn's disease, frame with no Crohn's disease, and undecided frame. We used through fuzzy filter. So this figure is illustrated the overall frame for detecting the ulcerative colitis. So this is we used the following algorithm, this one, and applying the contour and threshold filter to all the images in the data set. So this one is actually showing the contour and the threshold frame. And then both data sets that we used for capsule endoscopy contain higher scale of noise, where the augmentation technique may help in reducing that scale. So running the 2 augmentation technique will provide additional 2 data sets to experiment with. So the next step is our pattern size sensing, is to expose a deep learning algorithm to a small sample of 1,000 images with the hope that it can learn the most important features of the Crohn's disease. So a twin network of Siamese neural network is a class of network architecture that are capable to differentiate between any 2 images by learning from one shot. But in our case, actually, we use with both. We used Anchor, which comes from the expert, so that's why we moved to a Siamese neural network with triple ranking, which is very important. Those are the 2 data sets that we used for our experimentation, and those are the algorithms. First, we are converting the images from colored image to a gray image, and then we continued our implementation for identifying the Crohn's diseases. And finally, actually, those are all the algorithms. This shows that looking at the algorithms, this shows that between 20 and 60 is the low clustering, 50 to 80 is the mid clustering, and then 100 to 70 to 170, starting 70 to 100 is the best type of clustering. So as a conclusion, This technique actually it's described in this paper starts with image augmentation technique followed by Siamese neural network that can learn from few shots based on triple loss function. However, the